Nowadays, these days, our patients become older and older, and they become more and more complex, especially in a tertiary center like Westmead Hospital. And because of the complexity and their age, it often results in a prolonged length of stay. Now that carries multiple problems. Number one is the longer you stay in hospital, the higher the risk for you to develop complications from your stay, including hospital-acquired infections, as well as the fact that due to the complexity of the case, there might be further deterioration. Finally, because patients stay so long, we suffer from overcrowding of the hospital, which then results in a backlog in emergency. So what we implemented as a strategy was basically very targeted discharge planning, where from day one we basically plan and assess what the patient needs in all aspects of his health or their health. That includes medical issues, allied health issues, support at home, as well as nutrition, with the aim that the patient stay is very focused, very comprehensive, and that the patient can be discharged in an organized manner. Our work relates to the fact that we need to adequately reflect how complex our patients are in order to attract the right funding for these patients, to have adequate staffing as well as state-of-the-art equipment. Look, patients can be reassured that their hospital stay is as short as possible, while at the same time we try to address all the problems that have come up during the admission in order to assure that they go home safely. Also, they're not rushed out of the door at the end of the day. We're actually planning proactively for them to be discharged at a normal time early in the morning, so that their family can take time to pick them up, take them home, and make sure they're settled in properly. At the end of the day, it's a good result for the patient because they're looked after in an optimal way, while at the same time we assure optimal funding to their hospital and therefore the local community.